Today I shall be talking on a very common topic, primarily affecting the ladies, sometimes affecting the gents, and that is called as stress urinary incontinence. Now, continence means control, incontinence means no control. Now, patients, especially ladies, suffer from various types of incontinence, that is lack of control of urine. One of them is called as urgency incontinence, which patients typically suffer with overactive bladder. The second most common is what is called as stress urinary incontinence. By stress I mean not mental stress. Stress means abdominal stress. Many patients tend to leak out when they cough, when they sneeze, when they giggle, or they get up suddenly from bed, they tend to leak out urine. In initial cases, it's a drop or two which patients tend to ignore, but in severe cases it can be as ghastly as leaking out almost half the bladder capacity. Now, the causes are various for these, and simple diagnosis, simple clinical examination, and one or two small tests can go a long way in helping the patient. For example, when a patient comes to us in the OPD, we request not only us as a urologist, because primarily patients will always go to the gynecologist even if they have a urinary problem. Yes, there are some intelligent patients, or there are some very well-to-do patients who will come directly to the urologist. A majority of the patients, they go to the gynecologist and the gynecologist examines them. And so we always tend to request our gynecologist, and of course we also do the same, that examine the patient after taking the history, examine the patient with a partially or a full bladder, so that check whether they leak out urine. If they leak out urine, that is a classical diagnosis of stress urinary incontinence, and with a simple examination, lift the bladder up and you find that the incontinence disappears. This is a good example of a clinical diagnosis made in the outpatient of what is called as stress urinary incontinence. And we also quantify, nowadays we have what is called as an endovaginal or a translabial scan, which can give us accurate imaging pictures. Once upon a time it had to be X-rays, but nowadays with scans being the present day norm, we can get excellent pictures as far as the state of the patient's bladder neck is concerned, and we know exactly when they leak out. A proper history is very important because the majority of these ladies suffer at an older age group. Usually they are post-menopausal, and the classical history is they tend to be a little obese as age advances. They have a history of multiple childbirths. They have a history of difficult labor during the delivery. They have a history of use of forceps. Nowadays forceps is banned, but there was a time when forceps was the norm. So all these interventions tend to stretch the ligament of support to the bladder and causes descent of the bladder. And many of these problems come after menopause. Why? Because the circulating hormones, female hormones, estrogen, progesterone, to a large extent help the patients not to suffer from these problems. But once they are postmenopausal, or rather perimenopausal and postmenopausal, they tend to start leaking out urine. And in general, ladies are a little shy of complaining this. They tend to suffer in their own homes, and it can be what we call as a case of social incontinence. Essentially it means these patients are excellent control, but when it comes to coughing, sneezing, they leak out urine. So all these patients feel in their mental status that they are happiest when they empty the bladder. So preferentially they go pass urine into the bathroom and try to keep the bladder empty, so they don't leak out when the bladder is empty. Also, when these patients have to go out for even a small social function, the first thing they'll ask is, primarily they'll tend to avoid, or if they want to go a simple marriage function, they'll say, is there a bathroom nearby? They will never travel by bus long distance. They will travel either by a train where there's a toilet, or they'll tend to travel by the air. So all this restricts their lifestyle. Can easily be treated with, in early cases, with medication or some lifestyle modification called as pelvic floor muscle training. We have a good physiotherapy department where they teach them how to control their bladder, they teach them pelvic exercises. All these tends to help in early cases. When the case becomes a little more serious, that when the bladder is descended down further, then it will require surgery. Now surgery is excellent. It gives excellent results. Most of these cases we tend to operate under something called as regional anesthesia. We admit him in the morning after getting the routine test done. We do the surgery in the afternoon. We do under regional anesthesia because it's a simple tape. We just lift the bladder neck and the problem is sorted out. So in these cases, we ask them specifically to be conscious so that on the table we make them cough nicely so that we can easily use the tape, what is called as a transobturated tape or a tension-free vaginal tape. This gives excellent results. Once upon a time, we used to have various other operations, but with these two having come to the fore, the treatment success is so good that at the end of 5 years, 7 years, the recurrence rate is hardly any, and most of the times, if at all it recurs, is the patient's own doing. That is, they have done some violent activity or they have put on too much weight wherein the tape cannot sustain the weight. So it's called as a transobturated tape. It's done under regional anesthesia. We admit in the morning, do the surgery in the afternoon and discharge the very next day. There are a few do's and don'ts after the surgery. That is, we tell them for about 2 months, 6 weeks to 2 months, not to squat on the floor, not to use the Indian toilet for at least 2 months, not to sit cross-legged on the floor. They can carry out the normal exercises, but avoid these 2-3 positions because the tape can get unnecessarily stretched. Now we have excellent technique called as a transobturated tape, and I am sure everybody can think of getting it done for their own relative. All it requires is a simple question: do you leak out urine when you cough or sneeze? There is no great diagnosis. The investigation is also minimal. It all can be done in a very short time, in a day or two. The patient can not only get diagnosed, get treated and go back home, and with excellent results. So this in short is what is called a stress urinary incontinence and the treatment for it. Thank you.